Okay. Good morning, good afternoon, everybody. I think we'll get started. Welcome to our first webinar on ventilation and reoccupancy of schools during COVID-19. My name is John Holland. I'm the Chief Development Officer of Pinchin, calling in from Richmond, BC. As we speak, around 5 million students and staff returned to our schools and colleges 9 days ago after 6 months' absence. Quite unprecedented reoccupancy of buildings in our history, I would think. And the debate on the safety of reoccupancy is still alive in most parts of our country. In Western Canada, where I live, and potentially other regions, smoke from the Oregon and California wildfires have caused air quality advisories over much of the western part of the country, which compounds the challenge of maintaining indoor air quality and safety. Our monitoring results just this week show high PM 2.5 levels inside buildings as well as outside. So there's a bigger challenge for all of us as we try and keep our schools safe. Through all of this, you on this call are managing school and college buildings to educate safely and diligently. And through our series of webinars, this is our 6th since the pandemic started, we're sharing our lessons learned in our occupational health and indoor air quality practice through the pandemic with all of you to hopefully create better outcomes for all of us. So the webinar will take about an hour. We do have question and answer function on Zoom, which we'll be explaining in a minute. And there'll be a feedback form for you all to fill out at the end if you can, so we can help calibrate these presentations to better suit what you'd like to hear about. Next slide, please. So with that, just a bit of a background on the Zoom. There are a few functions we'd like to understand, get comfortable so that you can hear us all properly. There's a chat function, and that is just for you to ask technical questions if you can't hear or can't see the presentation. If you want to actually ask a question technically to one of the presenters, which I'll be moderating and try and answer either through the presentation or at the end, please use the Q&A function for that. It helps me combine them to see where the density of questions are coming from. And could people raise their hands just to show that the volume controls are working and you can actually hear us? Great. Thank you. Okay, next slide, please, Kaylee. So we have 3 speakers today on this subject, all of whom have some good experience in this area. Our first speaker is Steve Booth, who's the Director of Indoor Air and Environmental Quality at Pinchin. Steve has more than 20 years of infection control and indoor air quality consulting experience, including work with SARS, Norwalk virus, and many significant fire and flood damaged building restorations. Steve has developed standards for mold assessment and remediation and indoor air quality in Ontario through his work with the Environmental Abatement Council of Ontario. Steve is the Director of Environmental and Indoor Air Quality at an OHS at Pinchin, and he's based in our Mississauga office. Following Steve will be Dr. Jeffrey Seigel. Jeff is a professor of civil and mineral engineering at the University of Toronto. He's a member of the university's Building Engineering Research Group. He holds joint appointments at the Dalla Lana School of Public Health and the Department of Physical and Environmental Sciences. He has an MS and a PhD in mechanical engineering from the University of California, Berkeley, and a BSc from Swarthmore College. He's a fellow of ASHRAE and a member of the Academy of Fellows of the International Society for Indoor Air and Climate. His research interests include healthy and sustainable buildings, filtration and air cleaning, ventilation and indoor air quality control,
Looks like we lost John.
I think you may have lost me there.
Yes.
And our final presenter is David Shearer, presenting from Kelowna, BC. Dave is Director of Integrated Digital Services at Pinchin. He also manages our Kelowna, BC office. Dave was previously the National Practice Leader of Indoor Environmental Quality, where he managed a range of specialist air quality projects, including a response to many disasters, including the Bow River floods, Slave Lake fires, Fort McMurray fires, and the Okanagan Valley fires. Dave is actively involved in developing tech-based solutions for indoor health and environmental issues. and he'll be covering that in part of his presentation today. Next slide, please, Kaylee. And just a note for Jeff, Dr. Jeffrey Seigel. In lieu of a fee for this presentation, Jeff is making a contribution to the Francis Silverman Memorial Scholarship. These funds are awarded to graduate students at the Dalla Lana School at the University of Toronto, whose program of study is directly related to environmental health research and who demonstrate a combination of scholarly merit and financial need. And as Jeff put it, she was a wonderful person. She died sadly 2 years ago. Her insight and experience are exactly what we need in a pandemic. And the students who receive this scholarship are the next generation who will be leading us through these issues in the future. So a great cause, and there's a link to that if people would like to make contributions also as part of this presentation. So with that, I'd like to pass the podium over to Steve Booth to start our presentation. Thank you, Steve. Thank you, everybody, for attending.
Hi, John, or thanks, John. Thanks for that introduction. I'm Steve Booth, and I'm going to take the next few minutes of the presentation just to talk about sort of where we are with the pandemic currently, and you know what some of the specific challenges we face in school settings might be. So, I'll go ahead to the next slide, Kaylee. So, you know, I thought it was worthwhile starting this by just kind of looking at, you know, where we were when we closed schools down last year during the pandemic and where we are currently to try and understand that difference. So, you know, back in March of last year, we were, you know, seeing well over 800 cases a day, and that case number was, you know, rising nearly exponentially at the time. To sort of the peak at around, you know, 2,000 odd cases a day. And now, you know, after sort of really clamping down on things, we managed to get that exponential growth under control. And through this summer, we've maintained, you know, relatively flat numbers. And, you know, as you're all aware, you know, things seem to be ticking back upwards now from a case load point of view, although, you know, the rate of increase doesn't seem to be as steep as it was previously. So it certainly indicates that, you know, many of the controls we have in place are working, but that, you know, perhaps some additional changes are required. And, you know, so that sets the stage for where we're coming back into schools at this time of year with this sort of lower caseload, but, you know, a building caseload as well. So we have to be cognizant of that. So we move to the next slide. So, you know, I guess the question on all of our minds is, you know, with that caseload, with the pandemic in mind, how do we know it's safe to resume our activities in school settings? And, you know, these are unprecedented times and very much uncharted territory. There's still many things we don't understand. I think since the beginning of the pandemic, our understandings have changed significantly. And, you know, the rate of change has certainly slowed down, but you know, there's new information coming out fairly regularly. And then, you know, I think it's key for all of us to understand that the risk is never going to be zero when we resume activities, you know, until, you know, a fully effective vaccine's in place or herd immunity is achieved. You know, we're not going to see a zero risk of transmission. So, you know, even in those cases, arguably, you're not necessarily at zero risk of transmission. So, you know, given that situation and given, you know, where we are and you know, we can't predict the future. So, you know, we may see a little rise now and then it get back under control and see that kind of pattern continue. Or we may see, you know, that this is the beginning of a spike and that may continue. So we don't really know exactly where the caseload's going. So how do we move in? Well, you know, we need to really understand what the risks are. We need to take all reasonable precautions for those risks. And as a school board, we need to demonstrate, you know, our due diligence in that approach. So we need to understand why we're taking the control measures we're taking, and we need to communicate that out to the students and the parents and the teachers. Next slide, Kaylee. So on the side of communication, That's going to be a really key piece of reoccupying school settings and frankly any other buildings. I think governments have done a really good job communicating over the last 8 months. They've laid out repeatedly a set of precautions that are required to slow the spread of the virus. When it comes to reoccupying schools in particular, maybe we'll be able to do all of those things that public health has advocated. Maybe some of those aspects might change a little in school settings, and where we're confronting those changes in how we're occupying schools versus what the persistent message has been for the last few months. We have to be very careful about that, understand and really communicate well why those changes are acceptable, where they might be acceptable in a school setting. So we need to manage both the hazard, but the teachers and the parents and the students' perception of that hazard as well. So that really takes good, strong communication, regular communication to the user groups. We'll move to the next slide. So we'll talk a little bit about transmission of the virus, and there's really 3 ways we can spread the virus from one person to another. So the highest risk and the most likely means of that transmission is direct contact and droplet transmission. So that's where we see physical distancing come into play. Those large respiratory droplets are not likely to travel all that far. So when you're in close proximity to the person, it's relatively easy to pick those droplets up and then transmit the disease. On the slightly lower, the medium risk side is transmission through a secondary surface. So I'm sitting at a desk and I cough at my desk. I have respiratory droplets on the desk that have the virus, and someone comes and uses my desk later and picks those droplets up and then transfers them to their mouth or nose or mucous membranes and gets infected that way. And then still somewhat controversial, but definitely becoming a more pressing concern is the risk of airborne transmission. So the idea is that some of these droplets aren't just large droplets that settle out in that 2-meter radius, but some of these droplets are in fact smaller than that and can remain airborne for an extended period of time and could migrate well beyond that 2-meter radius, maybe collected by a building HVAC system and delivered back to other users through the HVAC system. So while that's still not well recognized by the World Health Organization, there's certainly a voice of more and more experts that suggest that that's certainly a possible means of transmission. And to support that, the American Society of Heating, Refrigeration, and Air Conditioning Engineers, or ASHRAE, have written a position paper and have some guidance on what measures should be taken to help minimize that risk of spread through HVAC systems. So we'll move to the next slide. So I think schools offer a substantially different environment for COVID transmission than do factories or work settings, which Pinchin certainly has been dealing with primarily over the past 6 to 8 months. So I think it's worthwhile for us to take a couple of seconds and think about all the things that are a bit unusual about school systems. So busing of students to and from classrooms. There's an opportunity for significant groups of children to gather together. That presents a spread. Certainly ventilation on things like school buses isn't going to be ideal. Even with the windows down, that's not a known quantity of ventilation, and that's probably not going to be likely to happen in January and February in Canada. Pre-entry interactions. So, we've all been to high school and public school settings where there are large groups of children interacting, usually in close proximity and relatively uncontrolled. So how are we going to manage those kinds of interactions? And then children coming into schools, traditionally we would have had lockers and cubicle areas and cubby areas for storage of equipment that would have led to significant congregations of students being in close proximity. So how are we going to manage those kind of things? We've really just got the kids in the door now, and we're already facing challenges. So we'll move to the next slide, Kaylee. So then when we think of the school day overall, we have a classroom that's the the obvious and the most immediate concern is that you might have anywhere from 10 to 25 to 30 kids in an individual classroom. So is that safe? How does that work? How can we manage that? Can we make class sizes smaller? We have things like portable structures for kids to learn in that sometimes don't have the best HVAC equipment. We have activities like gym class, like music class, where the possibility of generating those respiratory particulates is likely much, much higher than it is in a regular classroom setting. Then we have outdoor play structures, common areas like libraries. How do we manage washrooms? And then how do we deal with the administration side of things? So there's a whole range of potential risks in classrooms, in schools, that don't necessarily show up in commercial office settings or other institutional settings. We move on to the next slide, Kaylee. So one of the other challenge that we have when we think about school settings is there is a real diversity in infrastructure. So, there are many very modern schools that provide displacement ventilation to the classrooms, and that, may be well suited to provide lots of fresh air and ventilation in the way we ASHRAE recommends we do for school settings. But then we have lots of older stock buildings built in the 1950s and earlier, where there is basically no ventilation, where there's radiant heat. Air conditioning and ventilation hadn't really been considered when the buildings were put together. So, we have these two substantially different infrastructure models that may well be occurring within the same board. So we really need two different plans of attack to manage both of those situations. Next slide, please. And then, unlike an office setting where you'd have, working age adults for the most part in the building who are pretty responsible for, what they're going to do over the course of the day, or at least we hope that they are. We have kids and young adults in learning settings, and adults, frankly, in learning settings, from kindergarten age, where they may not fully grasp the risks involved and, not be diligent about hand hygiene and wearing face coverings and those kind of things that we might hope, to, teenagers who, might chafe against some of those controls and not be fully compliant with some of the measures we'd like to impose from a public health point of view for, for other reasons. We can move to the next slide. The other thing that's sort of tangentially related to the COVID issue is, things like we're going to shut off water fountains for the entire year potentially in schools because we don't want that shared surface being used. Well, that presents a risk of dead legs, and where we might have issues of metal leaching out of pipes that could cause drinking water issues down the road when we start those fountains back up again, and also present a risk for Legionella growth in those kind of water systems that might not be in use as much as they were previously. Even in schools where the occupancy is reduced because we have online learning, all the washrooms may not be in use in the same way. So we have to manage things like Legionella growth in those plumbing systems, in those sections of the school that might not be in use because of reduced occupancy. We move to the next slide. So, as we've thought about the risks that are in place, how do we manage those risks? And we really need to manage those risks by thinking back to the basic principles of occupational health and safety, and that really looks at these hierarchy of controls. So, we want to have the most effective controls implemented whenever that's possible. And then where we can't have that most effective level of control, we can implement, less effective levels down the line. So, traditionally recognized elimination is the most effective way. So that's physically removing the hazard entirely. And so how might we achieve that? Well, teachers working from home, to the degree that it's possible, health screening and sick time policies can keep people with COVID-19, or at least go part of the way to keeping people with COVID-19 out of the school setting. At the beginning of the pandemic, we simply closed schools, and that was a way a really good way of eliminating the risk, although that's certainly not where we hope to go again. And then obviously for school settings, online learning is a great elimination control. It provides the least risk of COVID-19 transmission because people are in their own houses. There really aren't substitution level controls, but from an engineering level control, how do we isolate the people from the hazard? We might have ventilation changes, we might have filtration changes, we might install plexiglass, we introduce things like physical distancing, so controls to maintain that separation. And I include, masks in engineering controls because the primary purpose of the mask is as a barrier to prevent your respiratory droplets from entering the environment. And while it functions as personal protection as well, I think its larger advantage is in that control barrier to stop you exhaling and spreading those respiratory droplets to the environment in the first place. Then we come down to levels of administrative controls, changing the way people work. So reduced occupant loads leads to smaller classroom sizes, leads to more physical spacing. Those kind of controls would help. Staggered start times for kids coming in and out of class. Those kind of options can help limit those opportunities for transmission. And then, last and least is really personal protective equipment. So, the mask certainly provides some limited protection for the wearer. How much it provides depends on the mask and how well it's fitted and those kind of things. But, really we should be looking at those other controls first and foremost, and that, relying on personal filtration of respiratory particulate as kind of the last resort. And with that, I'll pass it on to, I'm not sure who I'm passing it on to, David, I think.
Yes, I'm next. Thank you, Steve.
Thanks, Dave.
Great. So Steve has spoken about the risks and challenges in schools, and I'm going to share kind of a summary of the management concept for schools. So I am a parent of 2 young children. I just dropped my son off at kindergarten for the first time for a full day today, so that's exciting. I'm also come from a family of teachers, and for the last 7 months have spent a lot of time wrapping my head around the concepts of COVID risk and reoccupancy in buildings. So there have been a lot of discussions at the family level and at work about what this is going to look like. And I'd like to speak a little bit to those concepts here today. Next slide, please, Kaylee. And I'm experiencing a bit of a delay on the slides, so. So the Canadian school landscape. Essentially, the management approaches need to be calibrated based on regional risk. Looking at the extent of community transmission, currently you look at an area that I live in Kelowna, BC, where there's only 1 or 2 new cases a day, versus an urban area like Vancouver, where there are many more cases per day. This community transmission rate kind of impacts how school occupancy will be considered. Urban areas, the big cities are going to have more challenges related to this community transmission element. At-risk students and communities, so looking at individuals that may have health conditions that limit their ability to be in class in a normal way, and then also looking at students that may not have the students and families that may not have the economic resources to support some of the online learning that is happening. We're all subject to what the public health officers are going to say day to day, and they're constantly monitoring kind of the statistics and patterns and trends with transmission and evaluating how to put more controls in place. We need an agile plan. We need to be able to kind of plan for various contingencies and figure it out. This has been a roller coaster ride for all of us. Like, to think that when this all started, the first clue we had there was a problem was that people were flocking to buy toilet paper. That's a very different scenario than we're in now, where we're looking at getting back to school and something that at least resembles normal day-to-day life. Next slide, please, Kaylee. So alternatives to full occupancy. So a lot of school boards in March kind of had a full stop after March break. From that, a lot of lessons were learned about how to deploy technology and doing remote learning. This image on the right of the screen is actually my brother-in-law, Marco, who was featured on breakfast television in Toronto because he started making YouTube videos with exercise workouts in it for all of his physical education students to follow while they were at home during the pandemic, all using kind of amenities that were available at home to stay fit. So there are a lot of creative ways to kind of look at how that learning process continues. Hybrid delivery in secondary schools, so obviously looking at remote learning, online learning opportunities, as well as in-class scenarios. And then being careful about who we do allow back into buildings, limiting it to just the people that need to be there. So keeping parents at the door and not coming into the space as much as possible, keeping visitors out of the building, or making sure that at the very least masking controls are in place for those individuals. And then just looking at the day-to-day operations of a school and the other kind of staff, facilities, maintenance staff, trades that need to come in and get tasks and work done, and making sure that they're understanding of the sensitivity of the building, understand the risks that are at play, and have well-documented procedures for how to enter the school and have a minimal impact. Next slide, please, Kaylee. Health screening, so communication of health screening requirements, making sure that parents understand this, that if they're not feeling well, if their kids are not feeling well, that they're staying home from school. Making sure that there's well-placed signs at all building entrances that reiterate this case, just in case people are not being fully mindful of it. Temperature checks are something to consider. Again, I think these are effective at identifying positive cases where someone has significant symptoms, but asymptomatic individuals may not kind of be caught in a temperature check. Isolation areas for sick students and staff, making sure that there's a location in the school or in the classroom where if a child becomes ill or starts demonstrating COVID-like symptoms, that they can have somewhere to go and not be in close contact with their peers or colleagues. A response plan. So I think we've already seen in the news in the last week, specifically the last 2 or 3 days, the number of COVID cases in schools has increased. Some schools have had to enact this response plan. So I think it's important to kind of work through that, plan for it, start writing the emails before you need to start sending them, and develop a return to school protocol. So understanding what kind of steps need to be followed before a student that demonstrated COVID symptoms, what do they have to go through before they can safely come back to class. And I'll maybe demonstrate how old I am, a child from the 80s, but Ferris Bueller and him faking being sick to go to school, so he didn't have to go to school. I think this is one, if Ferris knew that he was going to have a swab jammed up his nose before he could go back, he'd probably reconsider these antics. So I think we'll see a different dynamic around health and schools and sick days. Next slide. Hygiene and hand cleaning protocols. So hand hygiene facilities are essential. Locating them in conspicuous locations is important, making sure that they're at the entrance to the buildings, anywhere that contact is going to occur. From a cleaning approach, focus on high touch surfaces. This can be easily identified by places that people touch frequently, doorknobs, computers, desks, surfaces. Basically, if you sit around for an hour and observe a school or a building and you see how people interact with the building and what surfaces they touch, then that becomes more obvious. Cleaning and disinfection is a two-step process. So the cleaning phase is to remove any kind of organic residues from the surface, and then the disinfectant is wetting that surface with an approved disinfectant for an extended period of time called the contact time. Could be a few minutes, so that it can do its work before it gets wiped off. So this process is a little bit different than probably most cleaners have been following in the past. It's more like the kind of cleaning that gets done in a hospital than has historically been done in schools. So it takes some training. There are safety data sheets and PPE requirements for some of these products, and those need to be considered as well. Next slide. Cohorts and learning groups. So students are being placed into small groups. It could be their individual class or a small grouping of classes, depending on the number of students in the school. This reduces transmission pathways. There are fewer students interacting. It compartmentalizes exposure and simplifies the contact tracing process. If there is an exposure that occurs within a particular cohort, if these learning groups are maintained, then that simplifies the process of figuring out who needs to follow either health monitoring or potentially quarantine requirements, and supports that further. Next slide, please, Kaylee. Physical distancing. So within public buildings, 2 meters of physical distancing has been the gold standard. This is challenging to accomplish in schools. The density of students in classrooms makes this difficult. The Manitoba Board of Education or Ministry of Education has set a rule at 1 meter physical distancing being acceptable. So to accomplish this, either class sizes need to be reduced or the space of the classroom needs to be expanded. I know that this is a contentious issue in a lot of provinces, but this is a challenging one to manage. So you look at a space like a gymnasium that might be less or underutilized during kind of current COVID requirements. You could potentially have classes held in that space, or cafeterias or other spaces that maybe aren't going to be used in their standard capacity to expand that space for accommodating students and physical distancing. Next slide, please. Masking. So it's basically a standard in public buildings. I think we can see day to day that this is a trend that's going to continue, and more mask wearing is going to be required in schools and businesses. Essentially, if you can't accomplish 2 meter physical distancing or whatever the physical distancing requirement has been established, then masking is the next step that allows those interactions to occur and reduce risk. So we've seen some school boards saying having full masking policies just in common areas in the school, or a purely optional masking policy. But I think as we see kind of the second wave gain some momentum, masking policies are going to become critical. Next slide, please. Other management concepts. Steve spoke about a few of these earlier, but around transportation, basically looking at how school busing is done, looking at assigned seating. So kids sit in the same seat every day, staggered through the bus. Barriers for bus drivers, so making sure that they're protected. In this photo here, you can see a bus driver that has a plexiglass panel around them. I've also heard about curtains being used for this capacity. So finding ways to separate the driver from the students on the bus. Staggering activities, so start time, so having different class cohorts come into the school at different times. Staggering recess and lunch so that you can maintain the separation of those cohorts. Class transitions as students are moving between classes and halls, limiting that or making sure that it doesn't happen all at the same time. No sharing policies, so pens, school resources, books, that sort of thing, making sure that they're not being passed from student to student, and that will limit the potential for surface transmission on those items. Water fountains and bottle filling stations. Essentially, water fountains are a high risk kind of transmission area. Bottle filling stations are a better alternative and support kind of better recycling and reuse of water bottles as well. Experience from public buildings, definitely communication is absolutely everything, and stakeholder engagement is challenging. When you look at the spectrum of kind of students and parents in a typical school community, you can vary from staff students, teachers that just aren't really very happy about being back in school, or aren't kind of happy about the risks that are present in the school, to individuals that aren't wearing masks couldn't care less and are just focused on getting back to normal. So managing that kind of diverse set of attitudes towards risk is challenging. It's generally human nature. It's challenging for people to actually understand and evaluate relative risk as it relates to their health. Planning can go out the window very rapidly. If you all of a sudden have an exposure event in a school, everything that has been put in place to that point kind of comes in question. If the kind of management plan has been built properly, the processes have built properly, it's important to kind of stay the course and see things through, but to also adapt and change as necessary if there are lessons learned from that process. And from public buildings, ventilation needs to be very carefully considered. So with that, I will pass the presentation over to Jeffrey Seigel.
Good afternoon, everyone. And what I want to talk about today is I just want to build on the previous presentations and talk mostly about ventilation, a little bit more broadly about HVAC and what it means in schools. And I'm going to start with some bad news. There are kind of 3 risk factors that are on the screen that we know are important for the airborne infectious disease transmission. Poorly ventilated spaces, crowded spaces, and spaces in which we spend a lot of time. And the bad news is, of course, schools very often satisfy all 3 of those criteria. And so they are high-risk environments. I think the other piece of bad news here is that this is not new knowledge. We've known this certainly for over 150 years. Harriet Beecher Stowe was writing about the domestic environment, and in one of her main books, she has 2 chapters, one on health and one on ventilation. And it was very clear, even to her, a long time ago, that crowded spaces and poorly ventilated spaces were critical to health. And this is a variant of a picture you saw earlier looking at the ways in which COVID-19 might be transmitted. And I won't go into detail because you already heard it, as well as some of the risks that are apparent. But the one comment I want to make about it is that we are trying to deal with a multifaceted problem here. And that is why we need to be considering a suite of solutions that include things like ventilation. And so moving from some bad news to some good news, the good news is that it's very simple. We've known what to do about indoor air quality for a very long time. The quote at the bottom in red is from Dr. Pettenkofer, who was a chemist, who's kind of the great-great-grandfather of the modern study of indoor air quality. And you know, the things we can do is we can remove the pollutant from the space. Once we've done that to the extent that we can, then we can look at ventilating the space. And once we've done what we can with ventilation, we can look at air cleaning and filtration. And so source control in the context of COVID-19 is all the things that you heard the other speakers speak about: masks, physical distancing, hand washing, surface cleaning. And so, you know, those are the logical place to start in this problem. And once we've addressed those, of course, they're not perfect. You can go to any grocery store and see, for example, the problem that some adults have wearing masks, for example, below their nose and that sort of thing. And so you can imagine that environment in classrooms as well. And so even if we have great source control, it's not going to be perfect. And so that's why we move down the list and also do things around ventilation and filtration. And there was a reference earlier to the ASHRAE guidelines, and they have a very nice kind of infographic, which I put on the screen here, that you can click through for specific information on different measures, as well as specific types of buildings, including schools and universities. And so even though we're dealing with what's obviously an unprecedented situation, there is guidance out there. And there's even guidance that's intended to be specifically helpful for schools. And the beginning of that guidance is around ventilation. So the table that's on the screen here is the minimum ventilation rates for some rooms and educational facilities from ASHRAE standard 62.1, which is the main residential ventilation standard that's used in most of the world, and certainly in Canada. And you can look up what the space is, and then you can figure out how much ventilation you need to provide. And it's kind of generally composed of two components based on how many people are in the space and what the floor area of the space is, or very often people use default values based on maximum occupancy. And so this is really the starting point for evaluating ventilation. And there's a couple of important things about these numbers. The first one is that it says explicitly in a footnote to this table that these numbers are not intended to protect against infectious disease transmission. These are meant to ensure acceptable indoor air quality. And so these are not the ending point, these are the starting point. And then the second comment about these numbers is that we have at this point a very established body of literature on infectious disease transmission and ventilation that of course it varies by disease and by some of the circumstances, but that increasing ventilation beyond these minimum standards will reduce infectious disease transmission. So from a school's perspective, the first thing that needs to happen is we have to figure out which environments in the school don't meet this standard, or in some cases can't meet this standard. And we need to figure out what to do with those spaces. It might be changing their use, it might be changing their occupancy, it might be adding systems. There's a variety of things we can do, but we want to make sure that at least this minimum is met, and then we want to increase as much as possible. Now, those who are in the world of HVAC know that increasing ventilation is complicated. Here are some of the challenges thinking specifically about schools. You know, does the ventilation system even exist? So an older building might not have a ventilation system, as we heard earlier. Even if it does exist, there's a lot of issues with deferred maintenance and things not working or maybe not working as design intent. And does it work for all spaces in the school? Remember that very often schools go through changes, additions, changes in space programming, and that can influence ventilation. Deferred maintenance is a huge issue. It's easy to neglect HVAC, and I think what we're facing in at least some schools is deferred maintenance it wasn't a priority, and now the system, we need the system to operate near its peak performance, and we need to do a bunch of effort to get there. But even assuming you have a system that you can make work and add ventilation, you might have an issue with conditioning capacity, and you might not have enough heating or cooling. And this issue really shows up a lot of times with cooling, where you have hot, humid days, maybe in the fall or in the spring, and you bring in more ventilation air, you can lead to poor comfort conditions, which we know are not a good thing in a school from a student learning perspective. There's also potentially an issue on the heating side, particularly in cold climates. And so, you know, we need to think about using controls that might be there already, or they might have to be added to say, we're going to increase ventilation as much as we can. And we're going to use ventilation. We're going to make sure we're ventilating a lot when the space is more densely occupied than perhaps when it's more lightly occupied. In some cases, we might have to think about supplementary equipment to maintain comfort conditions. The humidity issue came up already, and this is my pet issue. This is the thing that keeps me up at night, because, you know, we also know from infectious disease transmission that we want to keep the range of humidity in the kind of 40 to 60% relative humidity. And, you know, this is for a few reasons. Comfort is the one that's usually cited, but actually in the context of infectious disease, there's a couple of other things important going on. The first one is that As the air gets dry, and it might get potentially very dry if we're ventilating more, those droplets become much, much smaller that might potentially contain the infective virus. And they can transport much, much further when they get smaller. And so dry conditions can actually lead to a bigger spread of the droplets that contain the disease. The other issue is one of susceptibility. As our mucous membranes dry out, we become more susceptible to respiratory diseases generally, and there's every reason to think that that's true for COVID-19 as well. And so in a school's context, this is tough because, you know, an obvious solution might be in the winter to humidify, but humidification is a tricky business. It requires maintenance, it requires attention to detail, and not to mention cost. And so whether that's practical is going to depend a lot on the context in the school, but it might be another constraint on ventilation. Another issue on the hot side is, of course, we can do dehumidification. That might have to be done on a space-by-space basis rather than on the whole building basis, depending on the details. And John started off with some comments that included some about wildfires. And that's a general, or it's a specific example of a general problem. Outdoor air quality can be poor because of an extraordinary event like a fire, because of ambient air pollution, because of traffic pollution. And so there's an open question here with ventilation in some schools is, are you causing more harm than good? And that might mean that if you're ventilating, you also have to think about cleaning that ventilation air. One more caveat, and this one, it's unclear how much we should be worried about it, but there is some evidence in the literature that this might play a role in some transmission of diseases. So we tend to think about the kind of macro question of ventilation, but there's this micro question too of what's happening with airflow in the environment. And so you can have a scenario in any building, but maybe in a school, where the air flows in the space bring air from infected individuals to uninfected individuals. And this risk is probably going to go up as we increase ventilation rates because there's going to be higher velocities and stronger airflows in spaces. And so this is more a cautionary note, is just part of the reason is we have to ventilate well. We can't just simply add ventilation without thinking about some of these other issues in each space. A lot of the conversation, at least in the media, about schools and ventilation says, well, you know, opening windows is very important. And I don't want to contradict that. I mean, obviously opening a window generally will increase ventilation. But I do want to say that you're just creating an uncontrolled situation. Sometimes you're going to get a lot more ventilation. Sometimes you're going to get much less ventilation. You're going to have airflows potentially in the space driven by wind much more strongly. Noise can be a real issue. Humidity based on outdoor air conditions can be a real issue. Temperature and the comfort issues, as well as the outdoor air quality issues. And with an open window, you of course have no opportunity to treat that outdoor air. And I point to a couple of papers here by a French research group where they looked at indoor air quality. This was long before COVID in schools. And they found that opening windows did not always improve indoor air quality because, of course, it increases the prevalence and the concentration of outdoor pollutants. And so windows are a good kind of stopgap measure, a good measure to think about, but I hope we're doing more than just relying on open windows, not to mention the fact that a lot of classrooms don't necessarily have operable windows. You know, invariably, you're going to come across spaces that are poorly ventilated. Some spaces just can't be ventilated enough because of limitations of the building and of the systems that are in the building. We should all acknowledge those spaces are higher risk. You might diminish occupancy. You might think about things like portable filtration. If the resources are available, something like ultraviolet disinfection might reduce the risk in those spaces. But I think one of the most important issues, and this was brought up previously, is the communication and the transparency of communication is really what's going to lead to success about those spaces. People need to know why those spaces are perhaps different than they've been in the past, and what they need to know to use them safely. I want to make a few comments about filtration very briefly here. The first thing is, filtration does definitely have a role in treating recirculated air, but it really has to be done well. And if you have looked at a lot of filter racks in buildings like schools, you see a lot of issues like in this picture here, where you've got filters in a big rack and there's individual gaps around the filter, as well as, maybe places where the filter is pulling out of the rack entirely. And air will just go around that filter rather than through that filter, and you will not get the same level of treatment. So like with ventilation, you have to do filtration very well. Another example, and this is from a big box retail environment, but I bet it happens in a lot of schools too. What you see here is a roof parapet on the left-hand side and a rooftop air handling unit on the right-hand side. And this was a brand new big box retail building. We were there within a month or so of it being opened. And when you open up the door to the air handler unit, that's where the filter slides in. The filter in this particular unit was about 6.5 feet long, and it's a distance a little less than 3 feet between the edge of the unit and the roof parapet. So the filter could literally never be changed. It's got a rigid metal frame in this particular design. And so it was literally impossible for the filter to be changed in this unit because of where that rooftop air handler was placed. And the more HVAC systems you go to, the more you see this type of thing where there are some real fundamental limitations. So sometimes improving the filters means more than just putting in a better filter. And to get towards the end here, I think there's a much, much larger issue that we're talking about beyond COVID. And improving generally poor indoor air quality in schools has been linked to all kinds of positive outcomes. You get higher standardized test scores, you get decreased absenteeism, you get higher later in life salaries, and you get improved cognitive function. And unfortunately, the image that's there isn't the right part of the figure that I wanted, but it comes from the paper that's cited in the lower left, and the part that I wanted of the image looked at the evidence for whether ventilation improved cognitive function, standardized test scores, and absenteeism in schools. And the answer was there was pretty compelling evidence in the literature that ventilation improved all of those things. Although there was also some mixed evidence suggesting that you have to do ventilation well. And I think the really big picture here is that investing in measures like improved ventilation, improved filtration, that will reduce the COVID-19 risk transmission in schools will have a very big societal benefit, including some direct economic benefits. And so I hope that we take this moment where we're very focused on COVID-19 and use this as an actual societal moment to improve indoor air quality in general in schools and get those benefits. And I'll finish here with another quote from Harriet Beecher Stowe. I wanted this quote for two reasons. First, because she talks about the health of people in buildings as inmates, which I think is important for schools. But more seriously, the last sentence here is that there should be this recognition in our minds that good indoor air quality is absolutely essential to health. And that's even more so for kids in schools. Thanks.
Thanks, Jeffrey. I'm going to speak a little bit about the validation of controls related to COVID. So it's all well and good that we're talking about cleaning buildings really effectively, doing optimizing ventilation and HVAC, but how do we demonstrate that that's actually having the desired impact? So Kaylee, next slide. So this slide presents the hierarchy of disinfectants. I'm just waiting for it to tip over on my end here. And essentially, this is from the top to the bottom, microorganisms that are difficult to kill, down to organisms that are easier or more susceptible to different disinfectants. When the pandemic first struck, it was very challenging to find Health Canada approved disinfectants for coronaviruses or for SARS. This kind of concept helps break that down a little bit. So at the top, we've got anthrax and bacterial spores, C. diff, which is a hospital-acquired infection, going down into rhinovirus and norovirus. So norovirus has been a common health issue on cruise ships. Those are non-enveloped viruses. Coming down another layer within the hierarchy into aspergillus and certain types of mold, being relatively easier to kill. Down into bacteria, where we've got E. coli, salmonella, some of those foodborne pathogens that need to be carefully managed in food service industry. And then at the very bottom here in this little green section, we've got envelope viruses, so coronavirus. That's where the SARS-CoV-2 virus kind of falls in this hierarchy. So generally, if a disinfectant has kind of effectiveness statements on it with respect to bacteria, fungi, non-envelope virus, mycobacterium, or bacterial spores, it's going to work against coronavirus. So if we do reach a point where those Health Canada certified disinfectants are again difficult to obtain, looking to this kind of hierarchy of disinfectants can help identify products that will still work. Next slide, please, Kaylee. Cleaning effectiveness. So the big issue is it's challenging to maintain surface cleanliness to the level required for COVID controls. Again, cleaning of high-touch surfaces regularly is important. What does regularly mean? Typically 1 to 2 times a day. We've identified some technology that helps support quickly sampling those surfaces in real time to demonstrate that cleaning is working. Next slide, please. So this cleaning tool it measures adenosine triphosphate, which is kind of a building block of many living cells, bacteria, skin cells, amoeba. It's very commonly used in the food industry as an indicator of surface cleanliness. So basically this device here is a luminometer. The bottom right, you see some swabs, the ultra snap, super snap, and essentially the swab is removed from its packaging. A surface is swabbed using it, and then there's an enzyme inside the top of that sampling tool that you snap off and releases an enzyme into the swab that can then be measured using the luminometer inside this black device. So this allows you in real time to basically evaluate if a surface has been cleaned properly. And we've had success working with cleaning contractors to demonstrate to them what part of their process is working, maybe what part of their cleaning process isn't working as well, and get to a point where they can know what is required to effectively clean a surface to this COVID standard. Next slide, please. So why not sample for SARS-CoV-2? So Steve and I have fielded lots of inquiries from clients asking, hey, can you come into my building and test the air for the SARS-CoV-2 virus? And it is possible to do that. The technology exists. It's expensive, and I think we observe that it comes with substantial limitations. So the absence of the virus is not indicative of effective risk management. We're not really expecting to find the virus in the wild very frequently. Based on kind of the community transmission rates that we have right now, it shouldn't just be in every building. By demonstrating that it's not there, you haven't really proved that any of your cleaning processes are effective. So we're sticking with visually inspecting that cleaning processing, auditing it from time to time, and doing the ATP testing as a more helpful tool in assessing that your management plan and your cleaning process is working properly. Again, you could consider doing actual SARS-CoV-2 testing as a follow-up to an exposure event or an outbreak in a building, but I think its usage should be reserved for that purpose. Next slide, please, Kaylee. So another approach to measuring how effective these modifications to buildings are working is looking at real-time monitoring. Building IoT sensors have drastically come down in price from where they were a few years ago, and are battery operated. So they can be deployed into buildings very quickly and effectively. And then the data from those sensors can be pulled up into the cloud and reviewed using modern data visualization and analytics techniques. We have a platform that does this called Pinchin Core. Next slide, please, Kaylee. So the parameters of interest, indoor air quality parameters of interest around COVID, there's 3 of them. Carbon dioxide is the most significant one, and it's a measure of ventilation adequacy. So essentially we know there's a direct relationship between the number of occupants in a space and CO2 concentrations. So if you're seeing very high CO2 concentrations, it's a reasonable observation that probably 2-meter physical distancing is not being followed in that space. So it's a way of looking at the ventilation controls in place, looking at the size of the space, and looking at the occupancy load and evaluating if the controls are adequate. Next slide, please. The second parameter of interest is relative humidity. You saw a slide from this from Jeffrey a few moments ago, but essentially ASHRAE is recommending maintaining relative humidity between 40 and 60%. That's twofold. It limits the generation of virus nuclei, and also in this range, our lung tissues are most resilient to viruses. This will increasingly become a challenge in the winter months. The third parameter of interest, PM 2.5. So we know that the approximate size of those virus nuclei is around PM3. So if we can demonstrate that we have really good filtration and that we have low PM 2.5 numbers, it's a reasonable assumption that we'll also have ventilation that's going to be effective at capturing those virus nuclei and limiting that kind of spread through the air and through HVAC systems. Next slide, Kaylee. So this data gets pulled into a data portal, and it can be graphed in real time. This is a simple graph of carbon dioxide at one location in one of our offices that we have set up. But you can see in the middle of the graph at about starting time 8 or 9 in the morning, there's a jump in CO2. So there's occupants coming into the building. Then there's a dip after that, which I observe is probably around lunchtime. So people leave the building for an hour and then they come back, and then in the afternoon it looks like there was higher occupancy than in the morning. So you move further down the graph and you see a similar kind of signature the next day with kind of the same level of occupancy in the morning as there was in the afternoon. So we can look at this data and learn a lot about occupancy patterns in buildings. Next slide, please, Kaylee. This one is somewhat topical, looking at PM 2.5. This is the size of particulate that is most related to wildfire smoke. There's been a massive outdoor wildfire smoke event in the Western states that's impacting Western Canada. And it looks like, based on the models I've seen, that the smoke is traveling across the country. But you can see that on September 9th, there was an event that occurred that brought in that smoky air into 3 of our regions where we have office: Richmond, Kelowna, Victoria, and Abbotsford. And then you see a few days later on September 11th, there's a jump, and then a massive event which affected the Kelowna region and Okanagan starting on September 13th. So we can see the data. To me, this is kind of buildings and the air quality talking to us. And we can gather lots of observations for this that I think are meaningful to effectively managing IAQ in buildings. Next slide, please, Kaylee. So a quick summary. So COVID-19 is an envelope virus, and there are many disinfectants that are effective against it. If you need help selecting a product down the road, that's certainly something to look for. ATP testing is helpful for verifying cleaning effectiveness, much preferred over sampling for the actual SARS-CoV-2 virus using PCR. and that real-time data can be very helpful in figuring out occupancy patterns and making sure that our HVAC systems are configured kind of in a best possible situation to limit risks related to COVID. Thanks, Kaylee.
Okay, thank you, David. Thank you, Jeff. Thank you, Steve. Excellent presentations. We have got some questions. We've run a little bit over. I apologize for that, but good content, and some questions seem to indicate that. And I think everybody's still on the call that started, so thank you to all of you. One question on, pretty well, maybe for Jeff. Parents have been advocating for consumer-grade portable HEPA filter units. Public health has not given any clear direction other than to follow standards as per ASHRAE. How would you recommend deploying these units, if at all, in schools, Jeff? Are they appropriate, and where would you position them to be most effective?
Yeah, it's a great question, and I do, generally speaking, think they have a role here. They're not my preferred approach, but we're in a situation where, for example, a space can't be served by a central system or can't be served enough by a central system. So I always recommend people use independent reviews of whatever product they're looking at. In particular, they avoid products that emit ozone or other byproducts in their use. I think that there are consumer products. There are also a little bit heavier duty, more industrial grade products that I think should be considered. And in terms of sizing, any unit will have a clean air delivery rate. And it's a pretty straightforward calculation to go that's in ASHRAE and other documents that you can calculate kind of how many room air changes is being provided by the device. And you want a number, ideally based on the literature, to protect against infectious diseases. You want 6 per hour through the device. That's practically going to run into real noise considerations in a lot of environments. So maybe aiming for a lower number, like 2 or 3 per hour through the device, is more reasonable. In terms of placement, 2 comments about placement. You know, center of the room makes the most sense, but not near any obstruction is also okay. And you want to, in terms of placement, you want to think about, you know, maybe having one near the teacher that they control, because noise can be an issue with these devices. One other small point, but I'll mention it because it's important, is some devices have an outlet that points down to the floor where the clean air comes from. And we've seen just recently, a paper a few weeks ago came out that showed that the flu virus can maintain its infectivity once it's deposited on a surface and then resuspended into the air. And so if you are using a unit that has an outflow near the bottom, I'd suggest doing something like putting it on a stool or a chair or something like that.
Okay, thank you. A second question, I think these are all for you, Jeff, maybe 2 more. What should schools be doing differently in ventilation systems? I think it means design for future schools with the lesson of the pandemic. What would be a good point for people that administer school design to take away from this?
I think having the ability to easily increase ventilation would be my #1 thing that we've learned. And for the record, when I think about COVID measures, I'm not just thinking about COVID, because, you know, I'm sure we'll have another pandemic at some point in the future, but there's a lot of indoor air quality benefits we can get from being able to control ventilation. The other comment I would make is, you know, I think we're learning a hard lesson now about the importance of maintenance on HVAC systems. And so a really important point, and I know lots of designers do this already, but let's make sure we're making systems that are easy to maintain and, to the extent possible, low cost to maintain.
Good. And one more question relates to flow rates. And the question is, won't increasing flow rates, CFMs, create more movement, more turbulence? That's my paraphrasing, which will carry more microdroplets through the room. Is there a sweet spot of ventilation? Is too much ventilation a negative, I guess, is the question.
So the only evidence we have on this issue is from a meta review of a lot of other infectious diseases, about 40 papers that looked at the role of ventilation. And the main conclusion is increasing ventilation appears to always be good for reducing infectious disease transmission. I think that that's probably still true, but I guess I have a little bit of caution about, there's a lot of particular circumstances. And so this is why I think the people who should really be involved in this discussion are the maintenance and the facilities individuals who really know the school and the system well. And I think they could provide a more nuanced guideline than just increase it as much as possible. Although the comment I would also make is functionally system capacity is probably going to limit things before I'd start getting worried about air movement.
Okay. Okay, well, that's the bulk of our questions. We are 11 minutes over, so I do want to be respectful of both our panelists and our attendees' time. Thank you to the panelists for great presentations. Thank you for the helpers, Rui and Kaylee, for being part of the team putting this together. Thank you to all of our audience for coming to this and being part of the learning journey. As I mentioned at the beginning, you are going to be getting a questionnaire at the end of this. We'd very much like your feedback. If this works, if you'd like some different topics in the future, the purpose of this process is to share our knowledge with the broader community so that we can manage and mitigate the impacts of this virus as quickly and as painlessly as possible. So your part in that process to help us do that is both beneficial and very much appreciated. And with that, I will close this webinar. Thank everybody for attending, and stay tuned for future sessions. Thank you very much.